Boris Johnson will set out his winter COVID-19 plan to MPs tomorrow, which is expected to see a toughening up of the three-tier system and more areas being placed into the higher levels. So will those restrictions be enough to drive down the transmission of the virus to allow further easing of restrictions for Christmas? Well, joining me now to discuss that is Dr. Duncan Robertson from Loughborough University. His work focuses on COVID-19 modelling and analysis. Good to see you again this morning. Thanks very much for being with us. So where are we with cases at the moment? We're being told that they're flattening off. Is that your understanding?
Well, yes. I mean, we are seeing, finally, the number of cases, as you say, levelling off. But, of course, we have to look at these numbers with some, nuances. So these are detected cases. They aren't all the cases. So if you look at the heat map there for detected cases, we know that there isn't enough testing going on. So we know that because around 1 in 10 tests that come back positive, and that should be 1 in 20. So we know there's not enough testing, but it is levelling off, and that's great. But I think the thing to remember is we're at very high levels still of cases. It's not as though we get cases coming down and we've solved the problem, because of course if R equals 1, that just means we now have the same number of cases, the same number of hospitalisations, and sadly the same number of deaths.
Yeah, so you talk about hospitalisations there. How are we doing on hospital admissions?
Well, the thing with hospitalisations is it takes a little bit more time to actually see those figures come through. So if you look at the charts for the admissions into hospital, you can see there once again it goes into age groups with the oldest at the top. Slightly different age groups, but you can see really these are the it's really hitting older people, and of course with COVID, the older you are, the more risk you have of having complications and bad outcomes from this. So we see that if you look at that top line, that's over 85s, and in August there were 3 per 100,000 going into hospital, and now the latest figures from Public Health England show 150 per 100,000. So it's gone up 50 times since August.
Sorry, I was just going to say, if cases are flattening off but hospital admissions are going up in all age groups, are we seeing people in hospital now who caught COVID before the current lockdown?
Well, we're starting to see really it's about this time. And of course, these figures came out on Friday, but they're looking from 1 week behind that. So we are really seeing in these charts, it's on that sort of boundary of the lockdown coming through. So we should hopefully see admissions, as I say, not necessarily going down, but staying at the same rate. And of course, after you go into hospital, you may end up in intensive care or high dependency units. And this is where you see a slightly different dynamic. So, we know that bad outcomes happen to older people, but this is a chart of who actually is admitted to intensive care. So these are very sick people. And if you note that the age group that has proportionately more, so that's per 100,000 people again, it's 65 to 74-year-olds. These are the people who are ending up in ICU disproportionately. But of course, it's not just those. It's 45 plus are ending up in ICU. So it's not just a disease of the old people. Of course, old people are much more likely to have bad outcomes. But it's not as though there's a sort of threshold. If you're 40 or above, or even in some rarer cases younger, you may end up in intensive care.
Very useful, your heat maps, very informative. We're hearing now, of course, that family Christmases may be back on. Given all your research, given the data, I'd be keen to know what your thoughts are about that. Is it right that we should be able to mix with family for 3, 4, 5 days over Christmas?
Well, I suppose, asking that question is asking me about your risk. So in some ways, I can take my own risk about my own family Christmas. But as soon as I'm inviting my relatives over, I'm making a statement about their risk. And you could say, well, that's fine for my family, but that may be, it gets more complicated when the sort of networks you have at Christmas are larger. And of course, this is where, reducing the number of contacts you have is important. And it's not as though we get to the 2nd of December and everything magically fixes itself, because we've got 400 deaths a day at the moment, and if that's a large number. And so the other thing to remember is, of course, on the 2nd of December, something else does happen, and that's a million or so students moving around the country in this very short window between 3rd and 9th of December. So, of course, that's increasing mixing at that time as well. So it's not all get to Christmas and everything's fine.
Yeah, it's a good point about university students. And I also noticed from your data as well that cases are still rising in children. What are your thoughts about schools? Do you think they should have closed during this period of lockdown like they did last time?
Well, that's a very difficult question, and of course, with all these sort of decisions, it's not trivial. But it would be useful to know what we're trying to do as a country, because of course, children going to school is not just about children mixing. So I think when just after the first lockdown, if you think about the bubbles that were there, they were sort of 15 people in a bubble, 15 children in a bubble, and of course now it's a lot more. So you do get transmission amongst children. And of course, it's not just children, it's the parents and carers going to pick them up and congregating. So we are getting some transmission there. But of course, you've got to balance that against the overall overriding objective that you get harm to children if they don't go to school, and particularly it's disadvantaged children who may suffer more. And this is the problem with this disease, is it is a disease of the old, the disadvantaged, and other groups.
Of course. And just finally, and briefly, if you can, I mean, how optimistic are you about the next few weeks? Obviously, we know the vaccines are on the way, but do you think that, are you optimistic about the next couple of months? What are your feelings?
Well, I mean, we are preparing for a challenging winter, but of course, as you say, we have had this fantastic news about vaccines coming along, and in the spring, and the problem is we've got to get over this winter. So yeah, very optimistic for the spring and the summer, but of course, it's going to be a difficult winter, and it's really up to the government to decide how difficult that winter is. At the moment, we've got 400 deaths per day, as I say. Is that an acceptable number for the country? And of course, the other thing to remember is what we're trying to do with this, lockdown, is fundamentally we're trying to fix the problem, and that problem is test, trace, and isolate really isn't working. And how have we spent this month in this second lockdown fixing that national test, trace, and isolate system? So we don't want to get out of this lockdown 2 to just in a month's time go back into lockdown 3.
Yeah, it's a good point you make. Still a long way to go. Dr. Duncan Robertson, always a pleasure. Thank you very much.
Thank you.